Hello, everyone. Welcome. We're going to start with the translation slide.
Welcome to your meeting with ICM. The interpretation button should appear at the bottom of your screen, next to the Share Screen button. By clicking on the interpretation button, you can choose the language you would like to hear. The interpretation button will then transform this meeting into the selected language. To change the language you would like to hear again, follow the previous procedure by clicking on that same button. By default, you will hear the selected language at 80% volume and the original audio at 20% volume. If you would like to mute or unmute the original audio, click on the corresponding option within the language button. Enjoy your meeting. Bienvenue à votre réunion avec l'ICM. Comme la réunion propose une interprétation simultanée en français, le bouton Interprétation devrait apparaître en bas de votre écran à côté du bouton Partager l'écran. En cliquant sur le bouton Interprétation, vous pouvez choisir la langue que vous souhaitez entendre. Le bouton Interprétation se transforme alors en la langue sélectionnée. Pour changer à nouveau la langue que vous souhaitez entendre, suivez la procédure précédente en cliquant sur le même bouton. Par défaut, vous entendrez la langue sélectionnée à 80% de volume et l'audio original à 20% de volume. Si vous souhaitez couper ou supprimer l'audio original, cliquez sur l'option correspondante dans le bouton de la langue. Bonne réunion. Bienvenido a su reunión de la ICM. Como la reunión ofrece interpretación simultánea en español, el botón Interpretación debería aparecer en la parte inferior de su pantalla, junto al botón Compartir pantalla. Haciendo clic en el botón Interpretación, puede elegir el idioma que desea escuchar. El botón Interpretación cambia entonces al idioma seleccionado. Para volver a cambiar el idioma que desea escuchar, siga el procedimiento anterior pulsando el mismo botón. Por defecto, oirás el idioma seleccionado a un 80% de volumen y el audio original a un 20%. Si quieres silenciar o desilenciar el audio original, haz clic en la opción correspondiente del botón de idioma. Disfruta de su reunión.
Greetings, everyone. Lovely to see you all here, and thank you for joining us for your morning, your afternoon, and your evening time. On behalf of Aime, the Alliance to Improve Midwifery Education, we welcome you to the third of these webinars, where we examine the WHA Framework for Action, the 7 steps to strengthen quality midwifery education. Today's webinar, Step 3, focuses on building public engagement and advocacy. I'm Felicity Copeland, and I'll be moderating this session today. And I can hear a beeping. Is that just me or is it someone else? Is it stopped? Okay, sorry. I'd like to thank Bruna Bimbato, who's hosting this platform from Brazil for the ICM, and Chisato Masuda, headquarters New York, here with us on her leave tonight. Thank you. And to our interpreters who are translating for our Spanish, French, and Arabic speaking colleagues. Welcome. So rather than repeat what we did in the last 2 sessions and give an overview of the 7 steps, I think we'll move forward and just do a very brief recap on the 2 steps that we've previously had. So we'll start with leadership and policy. Thanks, Bruna. So the first step we looked at of the framework, leadership and policy, addresses the significance of establishing a strong midwifery presence at the National Task Force of Midwifery. So we wanted midwives at government and ministries level. We wanted them to be heard. And we heard from Dr. Pandora Hartman, the Jipaigo chief nurse and midwife, who gave us examples of how midwives' voices can be heard, how to be effective, warm-hearted, passionate leaders, and encouraged us to strive collectively for career pathways and development as midwives. The growth pathway of leadership never ends. And she advised us of the essential act of caring for ourselves, for pausing and reflecting, something that I think we really need to be reminded of as midwives. We heard from Dr. Diana Koro, the Sexual Reproductive Health Rights Advisor for UNFPA in Kenya, and he reminded us that The power of leadership is the power to influence and motivate people to grow and achieve common goals. It starts with growing and leading ourselves and extends to helping others on their leadership journey. Dr. Dan spoke of the importance of being positive mentors and role models and championing other midwives to take leadership roles. And he described midwifery-led models of care as being the perfect example of how midwives can influence and shape the experience of pregnancy and birth for women in a positive way. Thanks, Bruna. Step 2. Step 2, we looked at gather the data and evidence, and we heard from Andrea Nove, who's the lead author on the State of the World's Midwifery Report, and she talked us through how to identify those really important country-specific data, the significance of these indicators, and how we as midwives can be active participants in the data collection processes. And there was a discussion about the need for a standardized data collection tool to assist us or assist countries to collect accurate data. We heard from Brenda Zulu, midwifery educator from Zambia, and she gave examples of examining the indicators in reducing maternal mortality and morbidity, detailed the introduction of an effective near-miss tool. So thanks, Bruna. Step 3 today, building public engagement and advocacy. And the WHO framework for action states, the views and experiences of women, families, and communities are essential, and they should be involved right at the start of any advocacy initiative to make sure that plans for midwifery education will meet their needs. So we're going to come back to that today again and again. And we can also see that the steps interconnect. So by building advocacy and public engagement, we're also collecting data, which is step 2, and we're also being positive leaders, which is step 1. So we're going to see during the process of these webinars how all the 7 steps interlink and connect. So before I hand over to listen to our first speaker, let's just have a very quick look at an effective initiative involving public engagement and advocacy as an example of starting the step. So Bruna, can we have a next slide? This is a very well-known slide. I know it's got lots of words on it, but this is the White Ribbon Alliance, the Respectful Maternity Care. And we know we're all very familiar with this because this is the core, the thing that we do best in our midwifery care. And these words are like respect, privacy, confidentiality, dignity, equality. And the White Ribbon Alliance mandate for respectful maternity care is a very good example of how clear, consistent, and strong messages can become commonplace and guide the way that we approach midwifery practice. So their strategy was very, very, very simple. They listened, they asked to what women wanted, they listened to their responses, and they acted on what they heard. And they also galvanized others to act. And that's how this advocacy became so popular and so well known. And we know that advocacy can influence policymakers and stakeholders to allocate resources and funding to improve midwifery education. And that's what we want. We want funding and resources to improve midwifery education. But advocacy doesn't have to be large scale. And I'm sure that many of you are sitting here thinking, well, how can we possibly compete with a large global strategy like the White Ribbon Alliance? But midwives, you engage in advocacy strategies every single day in your midwifery care. Every time you look after a woman in labour, pregnancy, birth, postnatal, you are advocating for her sexual reproductive health rights. You are advocating for her self-determination. You are advocating for her choices. And midwifery educators, every single day, you advocate for your students. You advocate for them to have positive clinical experiences, to have the right number of ratio between clinical preceptors. You advocate for them to have clean, safe work environment. You lobby faculty so that you have the most up-to-date resources. That's advocacy. So I will stop talking in a minute, but what I want you to think about now, and please share in the chat, all the things that you can think of that you do as midwives in your role, in your scope of practice that are advocacy. We really want to share this on this global space. We want to hear from you. So please use the chat box. For those of you in a different language than English, the interpreters will translate for you. So please put something in the chat box for us to discuss and share. All right, I am now going to hand over to my friend and midwifery colleague, Erin, who's here today to help us moderate, and she is going to introduce our first speaker. So thank you. Over to you, Erin. Thanks, Bruna.
Good morning, good evening, good afternoon to all of you. Thank you so much for joining us. Thank you for inviting me, Felicity, to talk to my very good friend, Farida, who is the lead advocacy at ICM. And I've worked with Farida in the past, and I'm delighted to be talking to you today, Farida, about advocacy, because it's a really big thing. But I'll be honest, sometimes I feel a little intimidated to think that I have to advocate, because I'm not sure I'm the person who could advocate to change laws in my country. I know as a midwife, Felicity was saying that we advocate, and I'm seeing in the chat that people are pointing out how they advocate with fit women-centered care and advocating for healthy diets and advocating for human rights. But I would like to start by asking you, how do you define advocacy? What does it mean to you? And what do you think are some examples of how midwives can advocate?
Thank you very much, Erin. Good morning, good afternoon, and good evening. Greetings from Uganda, the Pearl of Africa. It is my pleasure to join you to share and also learn how we can position ourselves as powerful advocates to strengthen midwifery education and practice. But first, let's simplify advocacy. We know that advocacy means different things to different people, but there are cross-cutting themes in most of our definitions, and most definitions will incorporate at least one or two of these three elements, which is the message, the audience, and also the channel. So you can simplify advocacy using these three elements. What is it that you want, which is a message? Who do you need to get you what you want, which is an audience? Why haven't they been caring all along, and what do you need to do for them to get you what you want, which is the channels and other strategies and tactics. So in brief, advocacy is telling your story to a decision maker through various means with the express personal purpose of compelling that person to do or not to do something about your issue. And it involves influencing public opinions, policies, decisions to address specific issues or bring about improvements. And as advocates, we have the power to effect change and make that meaningful impact on the issues that we care about. So some of you are already advocates, and you're engaged in advocacy knowingly or even unknowingly. And midwifery educators can advocate for themselves in several ways. And this advocacy not only benefits them as educators, it also contributes to the overall improvement of midwifery education and the quality of care provided by the midwives. So you could advocate for professional development. And this, may entail advocacy for opportunities to enhance your skills and also your knowledge. You could advocate for access to workshops, to conferences and training programs that can help the educators stay up to date with the latest, practices and developments or advancement in midwifery. You could also advocate for, opportunities to engage in research that is relevant to your profession or midwifery education. And this not only contributes to your professional growth, it also enriches your education experiences with the students. You could also advocate for leadership roles, where you take on leadership within the educational institutions or even professional organization. And this allows you to influence decisions and policies around, midwives and midwifery education. And truthfully, many of the midwifery educators also practice as midwives. So you could advocate to support, the balance between your teaching and clinical roles and ensuring that all-round, perspective. I mean, there's just so much that we can advocate for. We could advocate for evidence-based curriculum development, hands-on practice. You could also advocate for specific things like, how do I attract more students? How can we train more students to be able to address the shortage of midwives in country X? So in all these, you want to ensure maybe you could also advocate for institutions getting better or, improved training facilities, more instructors or educators, governments to ensure better pay for the educators and also the midwives, improving the working conditions and making this a more attractive profession. But in all this, we need to use our voice as advocates. We need to be passionate and we need to influence to drive meaningful action and change. And as midwifery educators, we need to equip ourselves with advocacy skills that will empower us to effectively communicate our needs and also collaborate with stakeholders to drive positive change. So those are some of the brief definitions and examples of advocacy.
I like that I like how you're explaining that. It makes sense to me to think that advocacy doesn't have to be huge. I don't have to make a huge change to be an advocate, but what I'm hearing you say is even the small things I do as a midwife already, advocating for CPD or advocating to be a leader or how I'm teaching, all of those things you're saying are advocacy. So I'm a midwife and an advocate just because I'm a midwife. It's not too much extra I have to do. And I see in the chat a lot of people are still adding great things like women to be not physically or verbally abused by caregivers, which is advocating for respectful care, and making sure resources are allocated. So, okay, I'm getting what advocacy is. So what drives you as an advocate? I'd be curious, like what motivates you?
Well, what drives me? Having worked with and also for midwives over the years, I've seen many of them making a difference, even in other resource settings. And to me, this is quite humbling. I can only imagine how much more they can deliver in a supportive environment with good education and training, opportunities for them to improve their skills on the job, working in sufficient numbers and in that enabling environment. So this significant contribution that midwives play to save and also enhance lives motivates and drives me, to advocate for the things that they need to perform their broader role, of which, midwifery education is central, and, it plays a central role in shaping the future of midwifery. However, I must say that, advocates are, driven or motivated by different things. You may passionately support a cause, an idea, or a group based on your personal experience, but also this may vary from person to person. And these are probably some other common drivers for advocates. It could be passion and commitment. We should remember that the most impactful advocates are those that are deeply passionate and also dedicated to their cause. And their commitment shines through their words. It shines through their actions and the determination to make a difference. Advocates are also inspired when their audiences are responding to their issues. And we need to remember that advocacy begins to succeed, when audiences are inspired to act. And effective advocates are those persuasive communicators. You should be able to articulate your message clearly and concisely and explain like those complex issues in ways that resonate with your audience. Having a clear plan of action also helps us to drive this momentum. Successful advocates develop that well thought out plan, and they have strategies and they understand how to reach like a target audience, how to create those impactful messages, and how to choose the right platforms to amplify their message. But you also need to remember that good advocates must persist through difficulties and remain focused on their longer term goals. Sometimes there are challenges. It may involve setbacks and opposition, but you need to stay focused to your long-term goal. You may sometimes even need to pull back and calibrate to advance your advocacy efforts. In brief, those are some of the common drivers for advocates.
Yeah, you're saying that you've got to be passionate if you're going to advocate for something, and I guess it makes me laugh because I think, well, I've never met a midwife that isn't passionate about midwifery. They all want to talk about midwifery all day long, so it seems like we're all probably very good advocates. So let's talk specifically. So I'm understanding how I can advocate as a midwife, and even as a midwife educator for my peers with CPD. But I was thinking the other day when we were talking, it's as educators, it would be important for us to train our students to be advocates rather than then having to learn later. So how, as a midwife educator, could I train the students to be advocates?
I must say that I'm actually one of those advocates who strongly believe that, advocacy skills should be integrated into midwifery curriculum or as part of CPD, allowing midwives to understand their potential as change makers, but also as advocates for women's health and rights. And we know that once midwives are deployed in the field, they face many challenges that impede their ability to provide quality care. But first, midwifery educators need to equip themselves with advocacy skills and knowledge and empower students by passing on these skills and knowledge to them. You may not be, able to give what you do not have. So educators need to identify and leverage opportunities for learning. There are many advocacy capacity building programs and modules. It could be advocacy workshops. It could be conferences. And also the ICM's e-learning platform provides that free to access opportunity for midwifery educators and other advocates to ramp up their skills in advocacy at their own pace. So the module is available on the ICM website under the e-learning platform. There are several modules on the platform, including the one on advocacy, and we shall drop a link to the module in the chat. And educators must be also aware of the midwifery challenges and be able to articulate these to the midwifery students as much as possible. We know that when midwives enter the profession, they enter this profession with great intentions, but experience lots of occupational dissatisfaction, issues around understaffing that are leading to work burnout, issues around limited scope of practice, around this poor working environment in terms of infrastructure, in terms of tools, in terms of pay, that is not commensurate sometimes with the level of effort and the lack of opportunities for leadership and career advancement. So some of these challenges require that midwives speak up to address these barriers to provision of care. And the educators can empower midwifery students and practitioners to be confident advocates of themselves and of the profession. And they can teach, communication skills, public speaking skills, networking. And again, I'll emphasize that it's my hope that advocacy skills are integrated into midwifery education as much as possible. And because this empowers midwives and also our students to effectively advocate for their needs, collaborate with stakeholders, and drive positive changes.
So we could even be teaching our children. If we were watching this webinar with our kids, we could be talking to them about how to be advocates for positive change. Is that true?
Yes.
We can teach anyone to be an advocate.
Yes.
All right. All right. So I have one last question for you. I think that's all we have time for. And I heard Felicity mention that it's important to work with groups, like women's groups and things, but I'm interested if you could speak a little bit more about that. How do we identify who we need to work with around public engagement? And how do we engage those groups to improve specifically midwifery education? I understand how we might use women's groups to advocate for midwives, but how about midwife education?
Well, as educators, we need to ensure that our training for the students reflects the needs of women, their families, and also communities that they are going to serve. We need to interest ourselves in information about the needs of women. If women are demanding respectful maternity care or RMC, if they are demanding self-care, how do we ensure it's part of the curriculum or part of, opportunities for CPD when there's a review? So one of those actions, I remember from one of the Aime regional workshops, showed the need for us to update the curriculum to review, to reflect, those new developments in global health. So as midwifery educators, we need to interest ourselves in this, information. The participation of women, their families, and communities is very critical, and their voices matter just as numbers gathered in global, regional, and national reports, and these contribute to the evidence base. It could be mobilizing the community through public hearings or dialogues, where we are helping to raise awareness about the benefits of midwifery, where we're promoting midwives, where we are devising these community solutions to improve, their working conditions. So women also bring these stories to the forefront, and they've helped to drive change. Sometimes stories are one of the ways the human brain is kind of wired to make sense of the world. So stories are some of the people who are affected by the problems, a powerful way to kind of deliver the message. It could be people who are experiencing complications because, they failed to access skilled care. So the women are showing the need for midwives and midwifery care, and, they are the primary beneficiaries of midwifery services. Actually, one advocate said it makes no sense to advocate for midwifery if women do not want it. So women need to know that midwifery exists, and they need to kind of build that grassroots base. And the What Women Want campaign that Felicity talked about, and the midwives, I'll also refer to the midwives' voices quickly. These are very good examples of advocacy and social and public engagement. What Women Want asked 1 million women and girls around the world what they want for their priority request for quality reproductive health care. And, the women indicated they wanted more and better trained midwives. This was a number 4 request. The campaign was coordinated by White Bananas, but it also gave birth to another campaign. They were showing the need for midwives. And the new campaign that White Bananas collaborated on with ICM was the Midwives Voices, Midwives Demand campaign, which also surveyed 56,000 midwives from over 100 countries about what they needed. And the midwives indicated they wanted better pay, they wanted better training. So it's important for midwifery advocates to collaborate with organizations who are engaging women and use this information to inform their training so that it's reflective of the self-articulated needs of women, their families, and their communities.
I didn't realize it was number 4 that women were asking that midwives be trained better. So we could even just use that information in women's groups to advocate for midwifery education in general, that we should have resources and and access to what we need to train the midwives. And then I mean, I'm excited to think about the next time I work on a curriculum. I want to make sure I have local women there helping create the curriculum, and women's voices from advocacy groups and from even the Midwife Association to talk about what should be in the curriculum. That's what should be, right? We shouldn't be having global curriculums written without the people who are going to be cared for by these people. That's what you're saying?
Yeah.
Farida, I love talking to you. I can tell you're getting passionate because you're starting to talk faster too. So I can tell you're just getting fired up and you have a lot more to say. But I think we have to pass back to Felicity. I think we've got another interview, and I want to remind folks to use, we have a question and answer box that people can use, and people are welcome to put questions in, and Farida will be coming back to answer the questions at the end. And maybe we'll flip through the chat while we're not talking, Farida, and see what else people are talking about over there. Thank you so much for coming, and thank you for all you do for midwives. You're really changing the world, and I really appreciate it.
Thank you so much. I'm glad to be part of this discussion.
Rita, that was very exciting. And I scribbled down some of the beautiful things that you said. And what I really wanted to say was, my favorite was that advocates shine through, their actions shine through their words. And I love that. And you are a very good example of someone who's shining. So shining inside and out. That was very inspiring. And certainly, Erin, if you've got a moment to look through the chat, there's some incredible advocacy activities going on every day with midwives. Just some of them that I really wanted to highlight was, VBACs, the way women champion women to attempt a vaginal birth after a cesarean, or the way women counsel, midwives counsel women after a traumatic birth and supporting them. That's advocacy. That's advocating for their sense of well-being and their choice. There was quite a lot in the chat about men, which I thought was really interesting. And there was a beautiful comment, which I would love someone to come back and write more about, which was advocacy is courage over comfort.
I saw that one too.
Yeah.
It totally jumped out at me, and I thought, right, let's hear more about that. I think that was Boopy. Was that you? I think it was really good.
It's being brave enough to step outside your comfort zone and have those difficult conversations. I think that's what that meant. Yeah, that was really good.
I also saw people say to advocate midwifery programs to incorporate ICM standard of competencies, which is important, that we push for international, for using international standards, as well as I saw someone just say we need to advocate that midwives aren't nurses. And while some midwives are nurses, we need to advocate for midwifery being a standalone profession that provides care as well. Yeah, very, very true. And so I also want to reiterate what Erin said. Please put your questions in the Q&A forum. I know last session, we didn't get to respond to many of the questions, and we really apologize about that. We wanted to get back to you with an email with some of the responses. There were so many questions around gathering data and evidence that we didn't follow through. So I think in future, what we want to do is send out some responses after these sessions, because we know we've only have an hour. It's just the tip of the iceberg to introduce some of these concepts, and it's a little bit frustrating, we know. So thank you, Farida. Thank you, Erin. It's now my very great pleasure to introduce a very wonderful speaker, Suzanne Stalls. And Suzanne is the Director of Maternal and Newborn Health at Momentum Global Health. And I think I got that word wrong, Bruna. You changed it for me very kindly. And Suzanne, this will be a very interesting talk. It'll be very different. What we're going to hear about now is two very successful global strategies. So we're going big now. Farida's talked to us about the really intense qualities of being an advocate and how that drives you. And now Suzanne is going to talk to us about the WHO ENAP, Every Newborn Action Plan, and
Oh, Suzanne, I've got a complete blank. It starts with E. Preventing maternal ending preventable
Ending preventable maternal. Yes.
Thank you. Thank you. I need a coffee, and it's only 6 o'clock in the morning for you, and you are on it. So I'm sorry. So welcome, and I think you've got some slides you're going to share, and we'll have a great discussion along the way. And please feel free, everyone, to pop in some questions for Suzanne. So over to you. Thank you, Suzanne.
Thanks, Suzanne, and welcome everybody. Good morning, good afternoon, good evening, and thank you so much for joining us today. And I was struck as we were talking and Farida was speaking about advocacy that really midwives advocate at so many different levels. We advocate for the women that we serve and the families that we serve. We advocate for our colleagues. We advocate for our colleagues in our workplace. We advocate for midwives at a national level, and then we advocate for midwives at a global level. So what I'll be talking about today is a global initiative that has really kind of caught wind, and it may be just an incredible opportunity for midwives to both advocate for the women and families that we serve, and then also advocate for midwifery and midwives at a national and global level. These slides are complicated. We're not going to ask you to look at every last aspect, but each slide I'll pick out something important that I'd like you to pay attention to. So to begin with, just to explain a bit about ending preventable maternal mortality and the Every Newborn Action Plan. It's a global initiative that is supported and led by WHO, UNFPA, and UNICEF. And they have set global targets for all countries so that we can indeed reach the Sustainable Development Goals. So just look at the targets at the very top of the slide. So really, the target is to have less than 12 neonatal deaths per 1,000 births and less than 12 stillbirths per 1,000 births. And that's for the newborn. And then for the mother, the average maternal mortality rate of 70 per 100,000 live births by 2030, with a supplemental national target of no country with a maternal mortality rate greater than 140 per 100,000. And we all know that maternal mortality declined rapidly during the MDGs. And what's happened now, very unfortunately, in the past 2 to 3 years, partly due to COVID certainly, but the maternal mortality rate has plateaued and or increased in some instances. So we really have a lot of work to do. Next slide, please. So on our next slide, what the only part that I want you to pay attention to is that what we did, so our goal then is to reach this neonatal mortality rate, maternal mortality rate, and we have targets as well that are joint targets for both ENAP and EPMM. And I know the question is, well, now why do I care about these targets? And I'm about to demonstrate exactly why we care about those targets. So next slide, please. So I'd like you to look at target 1, target 2, target 3, and look at this. The first indicator is 4 or more antenatal care contacts. Second target is births attended by skilled health personnel. Third target is early routine postnatal care. Well, who is the person and who is the provider that gives that care? Well, it's midwifery. And one of the things that the global initiative has done is set these targets that are not, they're not similar to the HIV/AIDS targets, but given that the HIV/AIDS world was so successful in setting very simple global targets and then driving towards those targets, this initiative is really looking at doing the same thing. So we're using 90, 90, 80, 80. In other words, 90% of the world is attended, for example, women are attended by skilled personnel. And then 80% of all districts in all countries will have these births attended. So that's where we come up with the 90, 90, 80, 80. So that's kind of a goal that we can keep in mind. Next slide, please. So within that those coverage targets, we have milestones, and those milestones are a way of being able to define and understand whether we're making progress. So next slide, please, so we can look at those milestones. So you'll see here, and again, I know the question is, what does it have to do with midwives? Well, we're going to make it very obvious very quickly. So these are the milestones. So within the targets of reaching skilled birth attendants, antenatal care visits, postnatal care visits, these are the pathways by which these targets can be reached. And these are all sorts of different milestones, as you can see. And what I'm going to highlight today are the milestones of quality of care and health workforce. Next slide, please. So this is just one example of the milestone of health workforce, and it's the goals and the deliverables. So that there be a strategy for human resources for health that includes the accreditation of institutions. So very pertinent to midwifery education. Core competencies defined and measured, very relevant for midwifery education. A comprehensive workforce development plan for competent and respectful maternity and newborn care. And again, very pertinent to midwifery and the care that we provide. Equitable posting and distribution of skilled providers. We all know that oftentimes there's a very uneven and inequitable distribution of workers in terms of urban versus rural. And then also, again, here's another deliverable very pertinent to midwives, that the HRH strategies include improving the motivation and retention of personnel, including the appropriate remuneration. So next slide, please. So in May of 2023, there was a conference in Cape Town called the International Maternal Newborn Health Conference, and I hope that a number of you were able to attend that conference. And I am putting these countries' names up on the screen simply because if you are from these countries are now in the middle of developing what are called country acceleration plans. And these country acceleration plans are the plans that are being created to help meet these milestones for ENAP and APMM and to meet these coverage targets. So here is a huge opportunity for midwives at the country level to advocate for midwifery and for the health workforce of midwifery that can deliver this very needed, very critical quality of care. So I'm going to give you a few examples of a few countries that have written country acceleration plans where midwives have featured prominently, and they're very good examples of how midwives within ministries, midwives within professional associations, midwives that sit on the maternal newborn health technical working groups, midwives from councils can participate in this process and make certain that midwives are essential and viewed as critical as a means of attaining both the national targets and the global targets. So just quickly here, I want to point out, again, these are complicated slides. I don't intend for anybody to try and absorb them, but look underneath this one section where it says review and revise pre-service curricula and in-service training of doctors, nurses, and midwives. Oh, I'm sorry, next slide, please. Yeah, so just look toward the bottom of the page, and it says review and revise pre-service curricula and in-service training. So the partners that are involved here are the Bangladesh Nursing and Midwifery Council, the Director General for Nursing and Midwifery, and the ministry. So again, here is really an opportunity for us to advocate for midwifery care, the kind of critical ingredient to the health workforce for delivering maternal and newborn care, and to be able to say that, yes, we are seated at the table, we can advocate for both midwives and the women and families that we serve. So next slide, please. And here's another example from Liberia. And you can see here again that midwives are portrayed as essential, again, to achieving these milestones. So here's strengthening blood safety through training of nurses and midwives. You can see that the Ministry of Health is really engaged. This is an opportunity to engage and advocate within the ministries. You can see here at the bottom of the page that skilled birth personnel, midwives featured first, nurses and doctors have enhanced capacity in M&H competencies. So again, all of these really are just examples to illustrate that we have the opportunity in these country acceleration plans to advocate for midwifery as an essential component to providing quality care for mothers and babies. So I'll stop there, and I'm happy to answer questions. And Felicity, I know that you may have some questions for me. Thank you.
Suzanne, thank you. So great that's such a huge piece of work, isn't it, to get our heads around and to break down those strategies and those statistics. I'm just wondering, Suzanne, I'm really interested in the 5 coverage targets. Do you think, is it possible to get that slide up again, Bruna? Maybe not, but I liked it because it talked about the global, national and subnational. Thanks, Bruna. In the indicators, we had a global target, a national target, and a subnational target. And I think this, and Suzanne, I'm going to ask you to speak a bit more to this. Is this a really good example of how I'm thinking about midwifery educators and how they can advocate, and possibly having a subnational target and understanding what the district targets and the coverage were is a really good way of faculty to understand the specific health demographics of their particular district and what targets they need to reach, and therefore appropriately put that into their curriculum, embed those particular health demographic needs. Does that make sense, or do you want to expand on that?
Well, I think what's important here in looking at the global, the national, and the subnational targets is understanding essentially what's behind that in order to achieve those targets. And a lot of what this says is that, okay, one can argue that these are coverage targets and don't necessarily reflect quality, but still in all, in order to reduce the maternal and the newborn morbidity and mortality rate, the care that you see that's being delivered with these targets has to be of quality. So to begin with, as midwifery educators, then we have to look at what can we do to deliver the best midwifery education that we know how to deliver, given global competencies, really, that we've been so fortunate to receive guidance from ICM. And I think the other aspect of it, so one just has to do with how do we achieve these targets through these milestones with a competent workforce. And then I think the second point that really is worth consideration is, in order to have this much coverage, you have to have an adequate workforce. And in order to have an adequate workforce, we have to advocate for enough midwifery education institutions and enough students with enough faculty that we actually have the skilled workforce that we need. So it really can, we can look at this both from the standpoint of health workforce and the standpoint of quality of care. So I hope that answers your question, Felicity.
Well, that certainly speaks to milestone 6, doesn't it? That the health workforce, which is, crucial. And Farida mentioned earlier that, midwives are leaving the workforce because they're burnt out. And that comes back to looking after midwives, which comes back to leadership, nurturing and looking after each other and championing each other. So, once again, you can see how all these interlink. Yes, Suzanne.
And I think the other piece that I always think about is that, sometimes my children say to me, so when are you going to stop doing this work, Mom, and pay more attention to us? And I always say to them, when I know that my sister midwives around the world are not in a situation where there is one midwife and she has 10 laboring women and everyone has needs and there's a complication. I mean, that's just, it's not equitable for midwives, and it's not equitable or just for the women and families that we serve, in that we have to have an adequate workforce that is able to give the quality of care that midwives can give and that the women and families that we serve deserve to have as well. So as midwife educators, there's a very strong component, I think, of advocacy in terms of, advocating with our Ministry of Education or Ministry of Finance for adequate resources in order to have enough schools, to have enough faculty, and to admit enough students. So I think, it's what we do every day, and sometimes it sounds a little bit mundane, but I just want to underscore how important it is to be able to continue saying, both at the national level and the world, we need enough midwives. And in order to do that, these are the things that we need, and we need to be specific. I think that's the other piece about advocacy is, Farida mentioned the ask. And when we have the ask, I think we need to be very specific. We need this many schools, we need this many students, and it will require this many resources. So I think that's another key piece of advocacy, is being specific in our request and backing it up with data.
Yeah, that's right. You have to have the data to work out what you're advocating for.
Right.
One last question, because we've got a few in the Q&A, or actually the other thing, just to remind you, there's lots of people asking for the slides. So can we have permission to share those, Suzanne?
Absolutely. I just realized I need to fix the first slide.
Okay, that's fine.
Absolutely.
We'll let you do that. So just be reassured to our participants that the slides will be available. Just one last question or a comment, and this relates to a country that's done an amazing amount of acceleration in terms of midwifery education, and that's Bangladesh. And I know that you were speaking to that earlier. But a channel for really powerful advocacy is that midwifery association, isn't it? That strong midwifery association. And I know that Bangladesh was very strategic in formulating an association that would advocate. Did you have anything to add to that?
Well, I think Bangladesh really speaks to the fact that not only they really were strategic and careful in thinking through what needs to be present at all levels, both in from the public sector and from the private sector. And most times midwifery associations are in the private sector, but they, as a part of, a very thoughtful plan, they put together, they made certain that there was a midwifery post at the ministry, and that there was a midwifery council that governed education and practice. And then the professional association provided huge support and input and insight into how to operationalize these aspects of midwifery that really have to be in place in order for us to be the leaders that are needed for the country and the global level. So I think, I have precepted many midwifery students in my career, and I have always told them, if you become a midwife, by definition, you are stepping into the political sphere, and understand that in order for women to have the kind of care that they deserve, and to have the respectful care and the dignified care that every woman should receive, we have to be able to advocate at all levels. And we can advocate, like Farida was speaking, we can advocate within our midwifery institutions, our educational institutions, within our workplace. And then again, really critical to take up those national and global advocacy messages, and just get busy. And I think that and I think that, you know, that really, that saying is so important, that if you're not at the table, you're likely to be on the menu. So we don't want to be on the menu. We want to be at the table. And that requires all of us stepping forward and stepping oftentimes outside of our comfort zone. I think there's another famous saying that says, stand up and speak even if your voice shakes. And so it's a bit intimidating, and it can be you know, somewhat awkward, but the more you do it, the better you're going to be as an advocate.
Yeah, thank you. What a great way to end. It does remind me of Pandora in the first session talked about, just don't wait, just do it. You know, someone said, how do you be a leader? She goes, just do it. So yeah, so that's lovely. And it's also just that example about Bangladesh, really strategic, really comprehensive, you know, going multi-pronged approach. So really powerful, a great sort of example for other countries to follow. Oh goodness, we've only got 7 minutes left. This has been fantastic. Thank you so much, Suzanne. And I'm going to, Erin, have you been looking in the Q&A to see if we've got some questions that we
do. We have quite a few questions. I'll answer the first one that came in, and then I'd like the rest. Suzanne, you have a lot of questions to answer.
Oh dear.
No, they're good. They're good questions. But someone posted earlier on, since the woman's choice is key, if a woman strongly demands something negative, like she wants the child dead at birth, or for the woman to lie against the sex of her newborn, what role can advocacy play in this case? And I'm going to give what I think is an answer, but Suzanne, I'd be curious your thoughts as well. I think this is very difficult as midwives, that sometimes we have to sit with people who are wishing for a different outcome, or wishing they weren't pregnant, or suffering from violence. And I think the very first thing that we need to do is, of course, we have ethical duty, and we would not advocate that their child die or that we lie. But we do advocate that we take the time to listen to them and help them process, and maybe help them come to a different place in their feeling, or maybe just let them feel heard. And that's an important role in advocacy. Suzanne, do you have anything to add to that?
Well, I think, Erin, you're speaking very strongly and effectively to the interpersonal aspect of situations like that. And then I also always ask myself, so how did this woman come to feel this way? And you're actually touching on something that is another very favorite topic of mine, which is that, you know, if this woman you know, wants a particular gender, and oftentimes there is male preference, or she doesn't want to be pregnant. To me, what that ultimately speaks to is how we live in a world that oftentimes does not reflect gender equity. And that, again, as midwives, we have a very strong ability, and I think responsibility, to understand that at the end of the day, gender equity and inequity has driven a lot of the injustices on our planet. And we also have a strong role in being able to speak to that over and over and over again. Sometimes you say, oh, it's so discouraging. We've been, the gender inequity has been present for, millennia at this point. And I just, the way I maintain hope is to talk about the drop in the bucket theory, which is that we just keep, putting one drop at a time in this bucket, and one day the bucket will be full. So I look forward to that day.
And life is very different from our grandmothers and our grandmothers' grandmothers. Things do change over time. So I've got two questions for you about the targets. One, and I'm going to say both of them so you can answer them together because we're really short on time. Do midwifery associations have any input into the targets? And then another question, and I really thought this was great, is the targets are all in terms of maternal and child mortality and morbidity. But is there any room for there being a wellness approach? Why don't we reframe the targets in positive terms like quality of life, respectful care, reproductive age groups, and so on? And they're raising this question because they say it might be more motivating for midwives and people to invest in the approach. And just asking if you could share your views there.
I think that's a great question, and thank you for the question. The first thing I'm going to address quickly with the targets were set really by consultation between WHO and UNFPA and UNICEF. So I think the percentages that were established were deemed to be reasonable to attain, provided there's the investment that is required to reach those targets. So I think where we can have a huge amount of influence, and this addresses the second question that you have, is in those milestones, underneath those milestones, and I'm sorry this is so complicated. It took me a while to wrap my head around it as well, but there are milestones, there are deliverables, and then there are activities. And I think that where we have the opportunity, if we're participating at the country level and developing those acceleration plans, that we can insert activities that really look at promotion of well-being and positive, respectful care, as opposed to the focus on morbidity, mortality. So I think that that's an excellent point. And again, I just want to encourage anyone from those 30 countries or anyone who works at a regional level to look at how we sit at the table in these conversations.
Yeah. And if people want to be a part of this program, is it too late to be a part of your program? Someone's asking that from camera and they're not a part and they'd like to join.
I think from the national perspective, what I would do is be in touch with your professional association. And I'm sure that many of you as midwives and midwifery educators have connections with the ministries of health and the technical working groups. And I would definitely liaise with them and understand how you can participate in those conversations. Each of the countries with the country acceleration plans have groups of people that are working on the different milestones. So that's the pathway by which you can connect at a national level.
Great.
Great.
Felicity, I'm going to hand back to you.
Oh, yeah, I'm the mean timekeeper. It's we're out of time, unfortunately. What an exciting, stimulating session! It went so fast, and I want to thank you, Erin, so much for coming in as our guest moderator. Couldn't have done it without you, and a very special thank you to Farida and Suzanne. And really, the last 3 points were just reiterating the White Ribbon Alliance. We need to ask, we need to listen, and then we need to act on what we hear and galvanize others to act too. Thanks, Bruna. Please come back next week or in 2 weeks' time. We have got 2 more excellent speakers, and we're talking about how to prepare the educational institutions. How do we make our faculty strong, and what are the issues for midwifery educators? So that's step 4 in 2 weeks' time, August 29th. Be well, everyone. We will send you all the things you asked. I think you asked for Suzanne's slides. We will send you the recording of today. The resources are there, and we will endeavour to answer the questions from 2 weeks ago. So please, everyone, be well and look after yourselves and each other. And thank you for your attendance. Thanks, Bruna.
Bye-bye.